our wisdom, we decided to start giving them drugs
to help this
to
problem.
to help. Okay, this elimination problem, and as a result of our drugs, we knocked 6 decades off of their life expectancy.
And now they live to be 90.
And now they live to be 90.
Still pretty good.
Which is still real good. Okay, and actually, I understand that it's actually on its way back up. You see, because now we're a couple generations out of those drug uses.
Okay.
And it's starting to the population damage that we did is starting to right itself.
And then the average age in America is someplace around 70 to 75.
Yes.
Average age of medical doctors is 58.
Yes. Yeah. You know, and recently there's been a big push about, you know, the life expectancy coming up. Okay, that we're living longer now. Okay,
right.
But I always, you know, stress that is not a reflection of our health. I mean,
we're looking at the nursing homes.
We are sicker than we've ever been.
Yeah.
I mean, we've spent literally millions of dollars in asthma research. Okay, but yet you can drive down some highways and you see a big billboard out there saying asthma's on the rise. You know, we need more research dollar because we're losing this fight against asthma.
Right.
You know, asthma is the #1 cause for parents taking pediatrics to the emergency room now. It's not trauma. More children are taken to the emergency room for asthma attacks than they are for traumas.
How many asthma patients would you guess could be fixed, if that's a proper word, cured, with chiropractic?
A high percentage of them. Asthma is one of my favorite symptoms.
Right, yeah, I knew that.
Okay, when I have especially a child coming in who's been diagnosed with what's usually referred to as neurogenic asthma. Okay, the child seems to be fine, but if they start running or they get excited or they get into a stressful environment or a polluted air environment, well then the bronchial tubes fail to dilate, okay, and the child develops asthmatic symptoms. Okay, well, bronchial tubes are lined with smooth muscle, and we've known as early as 1922 that all smooth muscle is controlled by the nervous system. Every structure, every function is controlled by the nervous system. The nerves that provide the sympathetic supply to the bronchial tubes come out of the spine in the upper portion of the back, okay, above the shoulder blades, below the neck. Okay, that is the sympathetic supply to the bronchial tubes, and the jobs of those nerves are to cause the bronchial tubes to dilate, okay, under the appropriate conditions. Okay, well, if you have a distortion, okay, in the upper portion of the spine where the neck and the upper back come together, okay, then that nerve is not able to properly function. Okay, the information is not getting from the part to the brain or from the brain out to the part, and there's a failure of the bronchial tubes to dilate. So in man's wisdom, okay, we've come up with those inhalers. You know, the little poppers, the albuterols, the phenols, the Ventolin.
Make it dilate.
Right. We can chemically, artificially cause those bronchial tubes to dilate. A couple of problems with that. One, there's certainly the use it or lose it principle. Okay, if you put your arm in a cast and don't use those muscles for an extended period of time, well then the muscles waste away and atrophy.
Sure.
Okay, if you have neurological irritation and that nerve is not firing properly, okay, and all you ever do is artificially cause those bronchial tubes to dilate, well then pretty soon your body loses the ability to dilate them on their own.
So you're stuck on that.
And so you're stuck on that.
Have you ever seen any people get off of it though?
Oh yes, I have. And the longer they are on it, the harder it is to get off.
Right.
Okay. I mentioned in our earlier session that our body has a constant turnover of cellular tissue. Okay. Every 10 minutes or so, we make 50,000 new cells.
Right.
Okay. If we remove the distortion, take the pressure back off that nerve, and that nerve is allowed to heal. Once that nerve heals, then the tissues on the end of that nerve can also begin to heal. Okay. But you got to remove that neurological irritation for that process to take place.
So if child comes in, mother brings her child in and says, my kid has asthma.
Mm-hmm.
You adjust his back, line up his spine.
Yes.
If he's been out for 12 years, it's going to take multiple adjustments.
Right. What we know is that when a distortion occurs, it doesn't matter if it's in your spine or any part of your body, but if there is a distortion of a joint, and that distortion stays that way for 5 to 7 days, it lays down a layer of scar tissue. Every 5 to 7 days after that, another layer of scar tissue is laid down. And it forms like an onion skin appearance. One layer of scar tissue on top of another on top of another. Every time a new layer is laid down, the old layer becomes permanent. Okay? Scar tissue is non-functional. Okay? So you basically lock in your distortions. Now we can still adjust them and correct them and put mobility into the joint, but the results of those treatments are always slower and always less than 100%.
So the longer you wait,
The longer you wait, the more problems you have with the correction.
So that's fixable.
Exactly. Another thing about the allopathic approach to asthma, and this is some studies that have come out of the New England Journal of Medicine, the Journal of the American Medical Association, the British Medical Journal, the Lancet. These are well-established, good scientific journals. And these are studies that date from 92 up through the 1998 issues. What we know is that when you do things such as, well, the whole broad classification is called the beta antagonist drugs, okay? The poppers, the albuterols, the Venolins, the phenolin, and those sorts of things, the little inhalers.
Right.
If you use those inhalers, you increase your likelihood of death from asthma, and you weaken the bronchial protective mechanism, and it causes your asthma to get worse.
So, counterproductive.
It's counterproductive. But that's the only treatment they have. Once again, it's a case of pulling the plug to the red light. You see, when they went in with asthma, all they did was they looked and they said, oh, this child is not breathing good.
Let's fix it.
So let's fix the breathing. Okay, and so they came up with a drug that causes the breathing to change, but it still has a problem that caused it in the first place.
Well, if you forget to take your emergency brake off on your car, you have to give it more gas to go.
Right.
If it'll go.
If it will go.
Or bigger engine.
Right.
The solution, of course, is to take the brake off.
Right.
If you don't do that, there are other ways to make the car go fast, but it's going to create multiple other problems.
Multiple other problems, and it's going to shorten the life expectancy of that automobile.
Of the brakes and the engine.
The brakes and the engine.
Right.
The whole vehicle, is going to be compromised. And when we attack our signs and our symptoms with a drug that's simply designed to cover over the sign or the symptom, okay, then all you're doing is allowing the body to continue to work at a less efficient state. Okay, and the laws of this universe, the laws of thermodynamics, start kicking in.
So, vaccines are basically poisonous, and of course the obvious reaction you're going to get is, well, you have to, or else what about these diseases?
What about all these diseases? Now, they've played some games with us.
With the numbers.
With the numbers.
Oh, yeah, I knew that.
Yeah. Where do we start? Let's start with the granddaddy. That's the polio vaccine.
Right.
Okay.
Salk.
Yeah, the Salk vaccine. There were a couple of vaccines before Salk that caused catastrophic events.
Right.
Okay. People dying left and right. People developing paralytic polio. People developing meningitis. Okay, from the early vaccines. By the time Salk's vaccine came out, the incidence of polio had declined 75%.
What was causing the polio before that, you think?
Well, polio is spread through fecal matter. Okay, that's how it's fecal to oral. Okay, and so the abundance of polio was predominantly a sanitation issue. Okay, when we learned to flush our toilets, okay, remove our waste from our living spaces, okay, a lot of these infectious diseases started an immediate rapid decline.